Hey everybody, John Younger, Assisted Living Locators, here today with my good friend Diane Welch of Fallon Health Summit Elder Care. Hey Diane.
How are you today, John?
Terrific, thanks. Tell us about Summit Elder Care.
Sure. Well, first of all, I want to thank you for inviting me on your show and to share what I do for Fallon Health. Fallon Health has many wonderful programs that can help individuals, families of all ages. So I'm an account executive for one of their programs called Summit Elder Care. Summit Elder Care is a PACE program. It's a program of all-inclusive care for the elderly. The PACE model is based on the belief and experience that older adults with chronic care needs are better served living in their homes and in the communities whenever possible. So we provide individualized care and services for many aging adults that want to continue to live safely and independently at home and in the community rather than going to a nursing home. We have a care team that works with the individuals, their families, and caregivers to provide that level of care that's needed for them to live as independently as possible. The medical care includes exams, specialized visits, rehab, behavioral health services, dental care, hearing services, vision, podiatry, as well as transportation to medical appointments and to our center for our adult day program. And our care team consists of primary care providers, primary nurses, social workers, PT, OT, recreational therapist, or an activity coordinator, a dietitian, and home care. Once someone comes into our center, our participants will enjoy a hot meal, snacks, and activities. We have activities such as bingo, trivia, chair yoga, musical entertainment, and I think the most important thing is socialization. So many of our seniors are isolated and they just need that human touch and to socialize and to make friends. So while they're there at our center, they also receive medical services with our primary care providers, the nurses, the physical and occupational therapists. We have a dentist, an audiologist, optometrists, and podiatrists that actually come into our center. And we can provide the blood work, injections, infusions, bladder scans, EKGs, and x-rays, all while they're there for the day program. We have social workers that will provide the social support for them, for their families and the caregivers. And one of the greatest things is our staff is all dementia trained. We also provide in-home services such as medication management, nursing visits, personal care, light housekeeping, and meal preparation. And to top it all up, we become their health insurance. We provide the medical and prescription coverage with no co-payments, deductibles, or co-insurance. We currently have 5 locations. We're located in Worcester, Webster, Springfield, Leominster, and Lowell. And to be eligible for Summit Elder Care, the individual must be 55 years of age or older. They need to live in our service area, and they need enough assistance to qualify for a nursing home level of care. That one, you know, because I think of someone who's going into a nursing home, their level of care is a lot higher, or their needs are a lot higher. But to see if someone qualifies, what we do is we have an enrollment nurse that would go out to their home for a medical assessment. We want to make sure that the individual qualifies, and by needing assistance with 2 activities of daily living, such as dressing or bathing, sometimes they need supervision or cueing, they could be a fall risk. Maybe they don't need someone actually helping them in the bathroom, but just being outside of the bathroom just to make sure that they are safe and they're not falling. Or if someone has a hard time remembering to take their medication, or they may be on oxygen, or they need wound care. So Summit Elder Care is a government program, and we're funded by both Medicare and Medicaid, or Mass Health. We have government specialists that will fill out the PACE Frail Elder waiver through Mass Health. There's an application, and our specialists can help with that application. And for most of our participants, Summit Elder Care is at no cost for them. Mass Health has certain financial guidelines, and for the PACE Frail Elder waiver, their income needs to be $2,349 gross monthly income or below, and $2,000 or less for their assets. They can own a home or a vehicle, and that's not considered an asset. A lot of people feel, oh, I own a home, how can I, qualify for such a government program, but it's not considered an asset. Our government specialist, they'll do the financial assessment to see if they qualify for the Frail Elder waiver. And if someone is over income, they can still enroll with us. It just would be a shared cost. And Mass Health has a calculation for that. And if someone is over on assets, there are other ways of paying for our program. But I have to say, about 90% of the people do not pay anything for everything that we offer. I just really want to say how very proud I am of our care team, because they meet the individuals where they are, and they provide that specific plan based on their needs. I honestly, they truly think about what the needs are and how we can best care and serve them. During COVID, I just wanted to touch on this. Our care team didn't miss a beat. Our providers and nurses were making house calls. Our activity staff was going out to the homes with games and activities. And for some people, they were just sitting and talking with them. They were making daily wellness checks to see if their needs were being met. And I am very, very happy to say today that our day program is open. We have limitations, and we're taking all the precautions to make sure that everyone is staying safe and socially distancing, and we do work with masks. And right now, because the weather has been so nice, we do have an outdoor patio, so they've been able to go out and enjoy the nice weather and the fall, the crispness in the air. So if anyone has any questions or they would like more information, they can certainly call me. My number is 774-312-1006. And John, thank you again. This was a wonderful opportunity to meet with you and to share how Fallon Health and Summit Elder Care help all our elders age in place.
Diane, thank you so much for the information. What an amazing resource that a lot of people may not know about, but now they will. So that's terrific, and I commend you and your organization for the passion that you have for our seniors.
Well, thank you, and it's people like you, and I think it takes a whole community to keep people aging in place. That's what they all want, and that's what we do. And the people that you meet and I meet, I think we have a great village and a great team just to keep people healthy and aging in place. And you do a tremendous job at helping so many families.
Well, thank you,
so
Diane.
Thank you.
You're welcome. Everybody, 5 minutes with Diane Welch, Fallon Health, Summit Healthcare. Thanks for being on.
Thank you for having me, John. I appreciate it. Have a great day.
You too.